So this section on simple augmentations now, really onlay bone grafting and using EthOss in just about 90% of my cases. It's quite rare that I don't use it, and quite often when I'm using it, I'm really just using it to sort of improve things as well. So simple augmentation, what are we doing, why are we doing it? I'm really trying to improve the soft tissue profile. I want to use the additional bone volume that I create to remove that sort of classic concavity that we get around implants. So I'm trying to build out the buccal bone so that we get less of that. So it's trying to camouflage and hide the implant crown, and it's upregulating healing, it's allowing bone to infill into that area. So this is an example of a relatively straightforward case, but an immediate implant for a fractured lower left 4. You see that one has to come out. Okay, so this is when the tooth come out. You can see it was a surgical extraction because of the way in which it had fractured. We had to get down low enough to be able to leverage the tooth out. So we've still cut a flap, which is something that we don't normally do when we're doing immediates. And one of the things that we're finding with our immediates is actually often when we do raise a small flap and we place the EthOss as a sort of jump gap fill, but also as a buccal onlay graft, we're finding a nice improvement in the contour when we come to look at these afterwards. So if we run through and have a look at this, so you can see there we've got that nice sort of classic immediate appearance. This has been sort of shaped and designed using a Cervico custom healing abutment kit, and you can see we've got that nice sort of gingival profile there, and just sort of impression process there, and you can see the radiograph here and the nice contour. And one of the main points, if we come through and if we just look at it from the side profile and we look down, this is what I mean when I say we're trying to hide the implant crown. You can see it down there in the lower left 4 position, but we've got that nice sort of buccal convexity rather than a buccal concavity that's giving away the implant position. So buccal veneer grafts, again, using the material here, it's not imperative to use it. You can do this case without it. It's not mandatory, or it's not necessary for the implant's success, but it does improve soft tissue contour and it does improve the outcome, and I think it hides the feeling for the patient that these are implant crowns and not their own teeth. You can imagine looking at that image on the right there, if we just placed 2 implants in a 3-unit bridge, we'd have quite a sort of bulbosity of tooth, and we'd have a perfect little area to trap food just above it. So what we want to do with the EthOss is a veneer graft to really build that buccal bone out so that we've got a nicer relationship between that sort of buccal alveolus and the prosthetic teeth that go on. And this was a bilateral case as well. So this was digitally planned using R2 gate. Actually, these are Megagen implants that we used. And this is the buccal veneer graft. You can see on the right hand side there's a little bit of an impression of the gauze that's been left because we placed the buccal veneer graft, placed the gauze over the top and let it set, and it's set nicely, and then we're just closing over the top as well. I mean, this is also a case that I've used to show how we've avoided the need for a sinus lift with an angled implant and a short implant, but we've still used grafting to improve the outcome. So there you can see a before, during and after, and you can see the soft tissue profile there on the right hand side's improved far better than it would have been if we'd done nothing. So another buccal veneer case. This was a full arch case. You can see these anterior implants have ever so slightly limited alveolus available for this implant. This one on the upper right, sort of 2-3 region, is really close to the front, so we've done a buccal veneer graft here as well. And as we run through, I'll show you the healed photos of this. And there you go, healed image showing nice buccal contour and soft tissue protecting the buccal aspect of that implant, and it was otherwise ever so slightly limited.